Welcome to Dateline Health. This is Fred Lippman coming to you from the Alan B. Levan Innovation Center, which is a combined effort between Nova Southeastern University and the County of Broward. And today we have a very, something that I've always wanted to do, and it's been sort of an unstable situation for a while, is to have someone come in and talk to us from the Area Agency on Aging. Now, as I tell you, and I've told you over and over again as viewers, that, the state of Florida has the highest percentage of people over the age of 70 of any state in the United States. And we had the highest number of people over the age of 85 of any state in the union, in fact, many countries throughout the world. So I thought it would be very good to bring to you the CEO, Charlotte Mathers, of the Area Agency for Aging. Welcome, Charlotte.
Thank you for having me today.
Tell us what the Area Agency for Aging does and what it's all about.
Well, we're the lead agency in Broward County on senior issues. We serve seniors 60 and above, and we also serve individuals with disabilities through our helpline. We provide a variety of different services, some that we provide directly and some that we contract for. Some of our main services are the helpline that people can call to get information and referral to other services. We also provide Medicare Shine counseling, where we'll have people go out and to the community and provide presentations, or they'll actually serve people one-on-one in person or over the phone to help them pick the right Medicare plan. Just a little bit more on that program. I think it's really important because oftentimes people will see TV commercials and they pick their plan because of something that they see on the TV that way. And what happens is with our Medicare Shine counselors is they are the only unbiased counseling program in the state of Florida, and they will actually help people go through and navigate and pick the right plan for them. So it's a very important service. So I definitely want to go in a little more detail on that. We also provide health and wellness classes where we'll go out to different locations and help people. They are evidence-based, so they're proven to work. Anything from caregiving type programs, like we have a powerful tool for caregivers program, to arthritis program like Tai Chi for arthritis, and a variety of different programs to help people. And again, they really works and they're fun for people because they get to join others that are like-minded who are trying to improve their health. In addition to that, we have home delivered meals, congregate meals where people can go and socialize with other people at different sites and get a great meal. And we have emergency meals. If someone needs like short-term assistance, say they get out of the hospital and their plan doesn't cover the meals for them, we can actually help them with that. On top, I was saying on top of that, we have in-home services where we'll go in and provide a variety of different services to people to assist them. All of our services are intended to help people remain in their home and remain their independence. So they're all there to help support people as they age, where they might need a little help here and there in different types of areas. We have home repair program where we'll go out and we'll provide minor home repairs to help people. Just say suddenly someone is in a wheelchair and they can't get through the threshold of their house or their door. So they'll help widen the door, or they'll add some grab bars in the house. All of the services that are provided under the home repair, again, help to help people remain safe in their home and to be able to navigate the home as they age. On top of that, we also have a lot of different programs for Alzheimer's and dementia services. And we provide programs for the caregivers to help them as they're caring for their loved one who might have a memory disorder. We have a program called T-Care, which our staff will work with someone in depth to help them identify. It really works with caregivers to help them identify services and things that they need to better care for their loved one. And we have a ton of different technology that we've also added. Uniper, which is a TV program that actually, it's a technology that hooks up to the TV where people can actually connect with their loved one and take exercise classes on TV with other groups. We have ELLiQ, which is a wonderful IQ robot which she actually is a great companion to people. We've had a lot of people really say they love the ELLiQ because she's made a big difference in their life. We have Tranquility, which is a falls prevention type of program. It's a technology where it goes into your home and it's this radar where if someone's moving along and suddenly they fall, it will contact a help desk and the help desk will contact the caregivers right away. Or if needed, they would even call 911. So it's definitely for someone who has an issue with falling, is afraid of that. It's a definitely good preventative device and also a device where you can help act on it right away. So if someone does fall, they actually can get the help they need immediately. We have a very cool robotic pets that people love. People really enjoy those. We find they've made a big difference in their life. Cats, dogs, birds. And the name of the company is Joy for All because that's really what it does. It provides a lot of joy for people. And so those have been a great hit with people as well. And then we have this something called an IN2L tablet, which is a larger type tablet and helps people who might have some issues with maybe glaucoma. They can't see as well. They're larger so people can see them better. And they also take into account maybe dexterity issues that someone might have. So they're easier to handle. And people can connect with their loved ones through the IN2L tablet. And they can also take all kinds of different classes on it and programs that are good for cognition. They'll actually give them different kinds of exercises to help them. And they have a really cool program called Reminiscing, where they go back to years ago, the different types of music people loved, or they'll go back to visit a country where someone was from. So that also provides a lot of really neat things for people. So I think I covered all the technology, but we have a lot of different things that are helpful to people. And what I like about it is we kind of cover all different areas so that people can get the extra support that they need. The last thing I want to mention is if someone does need to be looking at going into long-term care, maybe they feel that their loved one needs an ALF or they need more extensive services to help them age in place, we are the official place that you go to qualify for long-term care services. So if someone wanted to get on Medicaid, Medicare long-term care, they would actually go through our helpline and we would sign them up for a screening and they would go through that process to qualify for that program. So we also are the official qualifying body for that as well. It's probably some things I'm forgetting, but that's kind of like a brief summary of all the things that we do. And in addition to all the services, we also do the area plan for seniors in Broward County. And we recently conducted like a community needs assessment. And we look at what the ever-changing needs are in Broward County. And then we'll recommend programs and create programs to address those needs.
What I would like to know, and really it comes from questions from our viewers. Now, we're on our 26th year of doing this, 27th year. So we're at about, over 600 broadcasts. And our broadcasts are driven by questions that come from our viewers. And a lot of questions, they might sound oversimplistic, but they're not to the people who want to know the answers. For example, if I'm on Medicaid or Medicare or both, do I have availability to your services?
So interestingly enough, if you're on Medicaid, Medicare long-term care, you're actually supposed to use that program to provide a lot of these services. If you're just on regular Medicare or regular Medicaid, you actually can use all of our services because our services are available to you.
What about the people? There's another question that came from a viewer. They've had for many years long-term care insurance, and they're also on Medicare. How do you deal with that?
If they have their own long-term care insurance and they're on Medicare, they're still eligible for our services. The only folks that they are not eligible are those who are on the long-term care program, which is the Medicare, Medicaid long-term care. But if you have your own insurance, you're definitely welcome to use our services.
And also, what is your association? I know that you have a lot of strong support from our local, and again, when I say local, I'm talking about Broward County, Although, do your services go beyond the borders of Broward County?
No, we have a primary service area we're responsible for, and it's only Broward County.
So, with that in mind, I know that we have some very, very strong advocates led by the new mayor, Nan Rich, the Honorable Nan Rich, who is for years, I mean, before she even moved to Broward County, because I dealt with her on issues related to the care of children, all right? The other side of the spectrum. But she must be really very anxiously involved, and hopefully she is, not hopefully, I know she is. She's got to be involved in many of the services that Area Agency for the Aging is involved in, that you brought to the public.
Mayor Nan Rich, Senator Mayor Nan Rich is actually one of our board members and very involved. She's someone I greatly admire because over the many years I've known and worked with her, she's always there for vulnerable populations, and seniors, of course, is one of those populations. She was on the housing issue way before it's turned into a crisis that we're all dealing with now. And she's been on the food issue, all of the issues that are really critical for seniors, she's been working on for many years. So yes, she's absolutely an amazing woman and someone I greatly admire because of her dedication to helping vulnerable populations. And she helps us a lot. She's very involved and has really great ideas about how to address issues.
She was a mighty force in enabling us to, I'm talking about the people of the state of Florida, of creating many programs for children.
Well, if I could say something, Senator Rich is very similar to you. I do want to acknowledge you because I've had the honor of knowing you for years. When you were in the legislature, you were always a major advocate for vulnerable populations as well, and created some great programs and legislation that many people don't even know that you did. And that is correct that Senator Rich is the exact same way. She created the Children's Services Council, and I know she's been trying to create a Senior Services Council, and she has been advocating for the programs and funding and different types of things over the years to really help people. So many of the great pieces of legislation she has been part of. And again, I do want to acknowledge you. I'm sure a lot of people don't realize how much you've done. They're watching your show, but they don't know your history. And I had the honor of watching you over the years and learning from you when I started in the legislature of all that you did. So again, I greatly admire Nan. She's an amazing woman. She's someone I really look up to. But I do want to throw in, I feel the same way about you as well with all the great things you've done.
You're very kind. Let's get back to Area Agency for the Aging. Number one is, how does one reach you? I would assume by, you have an email address, and I'm sure you have a telephone. Most people who are beyond certain age limits, and I'm not denigrating them in any way, but they don't have the utility of a computer or otherwise, but they have the telephone. They have they have it in their pocket. They have it sitting in their home. How do they reach you?
So you can call our main office line, which is 954-745-9567, or our helpline, which is 954-745-9779. And the other thing is, if someone wants to learn a little bit more about technology, we do have team members who will help teach people as well. So I do agree with you. A lot of people still are not comfortable with it. I can tell you myself, until COVID-19 kicked in, I'd never dealt with Zoom. And now I had to learn how to, work with it. So we do try to help teach people because technology is such a part of our society right now. But the phone works perfectly well. And we're also willing to go out to people's homes. And if, for example, if someone lives in a condominium area or neighborhood association where they'd like us to come out and present, our team likes to go out, and we'll go out and present. We can also provide classes in the area that they live in, like a lot of the health and wellness classes I spoke to you about. We'll go right out to the condo association rec room. We'll go out to the homeowners association room, wherever they're meeting. So we do want to come out to you as well. So The other thing is people can drive and walk in here. So we have walk-ins. So we're always open 8 to 5. People can come and just drive up and we'll have someone meet with them that way as well. And they can schedule an appointment.
Well, you know, we have seen the growth of ALFs, adult living facilities. I think it is a necessary thing, particularly, but in the area where we're broadcasting, we go all the way up past Palm Beach and all the way down to the Keys and all the way over to almost Fort Myers. So there are a lot of people that are at a point in time where they have to make a decision. You know, they've lost a loved one, they're alone, or they're garnishing the privileges of long life, and they move into an assisted living facility at different levels. You know, whether it's be just normal, what I would call day-to-day living, to cognitive issues, to other things, as you well know. But I hear it from these people who are our viewers, and they're wondering, are these services available, or do you have a communication with these corporate entities? And some of them are actually associated with hospital corporations as well. So we want to give that answer to our folks?
Yeah, so our services are intended for people who are not living in an ALF or in a nursing home. You could be in an independent living because that's independent, but it's intended for people who live in the community prior to them having to maybe go into an ALF. We do assist people through our long-term care process in getting people qualified so that they can get that state assistance when they do go into an ALF. And for that, you have to go through the screening. And that would be, you would become part of the long-term care program, and that would help pay for part of your, excuse me, not tuition, but your payment for living in the ALF. So if you do go through the screening process and you are approved, that will pay for your living in the ALF. But beyond that, the services I mentioned to you are actually for people living in their homes in the community.
Let me just get to maybe a difficult area, but that's part of your responsibility as the executive director. How are you, where do you receive your funding?
So some of our funding, the majority of our funding is federal funding that flows through the state and then comes through to us. It's the Older Americans Act funding, and it goes to this state office, the governor's office, and the Department of Elder Affairs. And then it's divided up. There's 11 area agencies on aging, which I want to mention that you mentioned this broadcast goes to other areas beyond Broward County. There are area agencies on aging who cover Dade County, Palm Beach County, and the West Coast. So you can look up your area agency on aging that you're living in, and you can contact someone, would be one of my counterparts, to access the same type of services. But the majority of our funding is that Older Americans Act funding, which is federal funding. We do also get some state funding. The state funding, we have Community Care for the Elderly, Alzheimer's Disease Initiative, Home Care for the Elderly, and that covers some of our other programs. And then we do also have some local grants. We have a program I didn't mention early on. It's an intergenerational program where we partner with college students. It's actually another great program, and that's funded by the United Way. So we do have funding from local entities, and Broward County government has been very generous. They, during COVID, observed what we did with our feeding program. And so we have that emergency meal program that is actually funded by them. The other parts of our feeding program are funded under that Older Americans Act funding. So again, in summary, the majority is federal funding, and then there's quite a bit of state funding, and then we have some local funding. And we do fundraising too.
There is the issue of what I would call the programs which we used to call respite programs, for the people who are the caregivers for the people that have cognitive and Alzheimer's intervention. A lot of that has been, shall I say, reduced in the capability to receive funding. I would assume, and you can tell me, that it creates more responsibility and pressure on the area aging councils.
We do have some funding that covers respite programs, but I have to say respite programs are critical because I work with caregivers all the time who contact me and they're just exhausted. When you're caregiving for someone who's your loved one, it's a full-time job. And oftentimes it's a spouse who's also older themselves caring for their loved one who's suddenly developed Alzheimer's, dementia, or has maybe more physical issues. And it's really exhausting for people, and they do need some support. I think respite is extremely important, and we could definitely use some more respite programs. Some of the programs that we provide can help with respite, in that if your loved one goes to a daycare center, that's providing respite to the caregiver. So that's really important. If they go to a congregate site and they have a meal with other individuals, that provides you some respite during that time period as well. We also have, under our community care for the elderly program, people will go in the home and provide some hours of respite, and we have senior volunteers who will do that. So there are some different programs where respite is available, but I definitely agree with you that respite is really critical, and we could definitely utilize more programs because caregivers need that extra help. And the truth is that if they don't get the help they need, then oftentimes they develop health issues. And sometimes they will crash before their loved one does because of the amount of pressure they have on them in caring for the loved one. And so if you think about it, when you have caregivers taking care of their loved one, that actually saves government tons of money because the loved one is not in institutional care. And so there's just so important. And I do think investing more in caregiver programs, or excuse me, in respite programs is definitely something that would benefit people.
The bottom line is that, the feeding programs work dramatically in giving the caregivers respite.
Yes.
Now, what is respite? It's you're taking the pressure off of yourself. You're a daughter, or you're a son, you're a grandchild, or whatever, and you have to watch someone devolve. Someone who you love, or they may get angry, they may get loud, they may get uncontrollable, they may have physical problems. But I think with people such as yourself, I know you for many, many years, and I admire your capability of not giving up on caring for people. It goes all the way from the many children that you worked with for so many years to the elderly, which now is your responsibility. And I'm really very happy, I'm very pleased, and I know the public agrees with me that to have someone of your capability monitoring and caring for the operation that you are responsible for, I want to say on behalf of the rest of the people, thank you.
Thank you for saying that. And I just feel so strongly that sometimes if you just give someone a little bit of help, it makes all the difference in their life, and you can help them to keep going and to take care of their loved one, and people can thrive. So it's my honor to do it. But I have to say, I'm super busy because there are so many people who need that extra help. So I'm glad to be here to be able to provide that help. And I do think we have a responsibility to help those that we live within our community because we're all connected, right? And we all want to make sure that we're helping people to have a better life. So thank you for saying that.
One more time, I'm going to ask you for your phone number. So would you repeat the number again?
954-745-9567. And then there's also our helpline, 954-745-9779.
Well, thank you, Charlotte Mather. I don't know what else to say except that I've known you for many years, although you still are a young teenager
Oh, I don't know about that, but thank you.
with a great cause, which is driven by intellect and caring for others. And I want to thank you on behalf of our viewers for the work that you do through the Area Agency for the Aging, but also particularly for you and involving yourself. I'm very happy personally, and I hope the people out there understand that I am talking for them, for the choice that was made for you to monitor, oversee, and create value through the Area Agency for Aging for those people who so desperately at some point in times need that attention. Thank you very much. Folks, we have come to the end of this broadcast. I always say to you, which doesn't necessarily relate to, well, it might. I always say if something is happening, you don't feel well, you go to a pharmacy or you go to a supermarket or whatever, you pick something up off the shelf and you think it's going to just take care of everything, please talk to your doctors. Talk to the people who are responsible for your health care. And that's the only way that they could lead their patients to venues or treatments or otherwise. They're the ones who make the decision. Please get the opportunity to get that help for yourselves. Not for anyone else, but for yourselves. Remember, this program is called Dateline Health. Comes to you from Nova Southeastern University at the Innovation Center, which is the Alan B. Levan Innovation Center. And remember, till next time, this is Fred Lippman coming to you from NSU. See you.